Hi, I'm Marc Gorelick, President and CEO at Children's Minnesota, and I'm here today with Dr. Saul Snowise. Dr. Snowise is a specialist in maternal and fetal medicine, and he is the medical director at the Michael and Ann Cerisi Midwest Fetal Care Center. Thanks for being with us today, Saul.
Yeah, thanks for having us.
So tell us, what is the Midwest Fetal Care Center?
Well, I think in a very simple statement, it's a center of excellence. And what that is we are there to help women who are pregnant. Pregnancy is usually a very happy, healthy event, but for a small portion of people, it can be a very challenging event with abnormalities in the baby or babies or complications with the babies. And we are a group of specialists that have come together to help diagnose problems, fix those problems in utero if we can, otherwise get the patients to the right place, delivered in the best place and in the best possible condition.
I've had the opportunity to meet some of the folks there. It is a very impressive team. Tell us about the team of folks you work with.
Yeah, so it truly is a multidisciplinary team from the physicians, which include, as you said, maternal-fetal medicine doctors, pediatric surgeons. We have two physicians, myself and Dr. James Fisher, who have done a specialty training in fetal intervention, so specifically for this problem. We have Dr. Joe Lilligard, who runs our open fetal program, who again trained in that back at Children's Hospital of Philadelphia, one of the starting and founding members of open fetal surgery. We have pediatric cardiology with Dr. Lisa Howley. We have an incredibly talented group of nurse coordinators who go above and beyond what they do to help patients coordinate through these incredibly difficult times. Some have to relocate from far away, spend months here. We work incredibly closely with our NICU team headed by Andrea Lampland, to our imaging specialists doing MRI, and to our anesthesiologists who handle incredibly complex cases and work with pregnant women. It's always a higher risk. So it truly is a truly multidisciplinary group, social work as well, geneticists, bringing everything together so the patient who's having a difficult time, stressful time, can come to one place and in one place get all the care they need for the complications they're having.
That's phenomenal. You talked about the fact that, for most people, pregnancy is a happy time. And if they get news that there is or may be a problem with the baby, that's got to be incredibly stressful, anxiety-provoking. How do you support the families through that?
Well, I think the entire team takes the same approach. Patients have decisions to make when it comes to a complicated pregnancy, whether it's a decision to go to surgery, not have surgery. Some choose not to continue with pregnancy. There's a whole plethora of decisions that patients have. Our job is not to make the decisions, but to kind of give the patient all the information they can so they can make an informed decision about what's best for their family. Because it is different for every family what the best choice and best option is.
Yeah, that's a great collaborative and family-centered approach. When you're counseling families, obviously one of the things they're going to ask about is what are the outcomes like? So talk about that. How are the outcomes for the work that you do there?
So, it's one thing our team prides itself on is the outcomes that we have. And again, anybody can say, hey, we do great, but we actually, as we've talked about before, pride ourselves in this. We put our outcomes up on the website. They're there at the Midwest Fetal Care Center website for people to go up and say, hey, this is what we do. The main two things that we track and follow are open fetal surgery, specifically for myelomeningocele repair, for spina bifida repair. Mm-hmm. And we look at the neurologic outcomes for that. And we benchmark ourselves against the MOMS trial, which is the original trial looking at spina bifida repair, antepartum versus postpartum, but we also benchmark ourselves against other programs. So, for example, for the twin-to-twin program, for the laser program, we benchmark ourselves against well-established programs where I trained, so University of Texas, Houston, and we compare ourselves, and are we doing as well or better than these other programs? And again, we're not trying just to do okay, we're trying to get better results. We're trying to improve the field, improve techniques, improve outcomes for families.
That's great. You mentioned this twin-twin transfusion syndrome. I know that's one of the most common things that you all deal with. Can you tell us a little bit more about that?
Sure. So twin-to-twin transfusion is a condition that happens in monochorionic twins, meaning they share one placenta, which means it's one egg that divides roughly between days 4 and 8 of pregnancy. And although the kids are each in their own sac, there's sharing of blood across vascular connections on the placenta. And in about 10 to 15% of these cases, the vascular connections aren't equal. And one baby literally is transfusing or donating volume to the other. What happens is you get a situation where one has too much volume, the other one doesn't have enough. And if under 20 weeks or under 24 weeks, if we do nothing 90 to 100% of the time, we'll lose one or both of the babies. So what we can actually do is go in with a special camera, a 3 millimeter camera, and we can go in and we can actually identify the connections. We ablate all the connections and then do what's called Solomonization, which is truly connect all the dots. So we literally dichorionize or separate all the vasculature for the two placentas. So we take a disease process, like I said, where 90 to 100% of the time we lose one or both of the babies, where our outcomes right now are roughly around 74% dual survival, and 95% of moms will take home at least one healthy baby.
Wow. Well, it's very clear that you and the rest of the team at the Midwest Fetal Care Center have just incredible expertise, and it's a great example of the kind of really highly specialized pediatric care that Children's Minnesota provides so well and better than anyone else. And really appreciate you taking some time to help us understand the work there and help people understand that Midwest Fetal Care Center, Children's Minnesota, is the place to come if you need fetal diagnosis or treatment. Thank you.
Yeah, thanks for allowing me to talk about the center. Appreciate it.
You bet.